Welcome back to Learn with MedNuggets. Today we are going to talk about glaucoma. Glaucoma is a condition that results from raised intraocular pressure. Intraocular pressure is a measurement of the fluid pressure in the aqueous humor of your eye. It's created by resistance of aqueous humor flow through the trabecular meshwork in your eye. The normal intraocular pressure is between 10 and 21 millimeters of mercury. In order to understand the concept of raised intraocular pressure, let's have a look at the anatomy and physiology of the eye. The vitreous chamber makes up the bulk of the eye, and this contains vitreous humor. The anterior chamber lies between the cornea, which is the clear outer layer at the front of the eye, and the iris. The posterior chamber is the space between the iris and the lens. Both the anterior and posterior chambers are filled with aqueous humor. Aqueous humor is a fluid that is produced by the ciliary body of the iris. It circulates around the iris from the posterior chamber to the anterior chamber of the eye and drains through the trabecular meshwork into the blood through the canal of Schlemm. Once it reaches the blood, it gets reabsorbed into the body. Glaucoma happens when there's increased resistance to the flow of aqueous humor. This can result from an increase in resistance in the trabecular meshwork, which is also called open-angle glaucoma, or due to narrowing of the angle between the iris and the cornea, which could happen due to the lens pushing against the iris. This is called close-angle glaucoma. Increased intraocular pressure can damage your optic nerve. Think of it like a bike tire filled with air. If you keep pumping air into the tire, the pressure inside the tire would increase, and the weakest part of the tire would eventually thin out and bulge outward. And this is the same thing that happens in your eye. The optic nerve is the weakest part of your eye. The raised intraocular pressure will press against your optic nerve and form a bulge, which we call optic nerve cupping. An optic cup to disc ratio of more than 0.5 is indicative of glaucoma. This can damage your optic nerve and cause vision loss. Acute angle closure glaucoma is an acute process which can lead to abrupt loss of vision. On the other hand, open-angle glaucoma is more of a chronic condition that can lead to a buildup of pressure in your eye over time. So it's important to get your eyes tested regularly to prevent irreversible damage to your eye. Some of the risk factors for open-angle glaucoma include increasing age, a family history of glaucoma, Black ethnicity, and myopia. The risk factors of close-angle glaucoma include increasing age, female gender, a family history of glaucoma, Chinese or East Asian ethnicity, a shallow anterior chamber, and medications such as adrenergics, anticholinergics, and tricyclic antidepressants. Out of these, the most important risk factor is a family history of glaucoma. People with acute angle closure glaucoma present with a severely painful red eye, blurred vision, halos around lights, and with associated nausea, vomiting, and headaches. These patients may have a hazy cornea, tearing of eye, and a dilated pupil. If you palpate the affected eye of these patients, you will feel a hard and firm eyeball on examination. In contrast to this, people with open-angle glaucoma are mostly asymptomatic due to the gradual increase in intraocular pressure in the eye. Most patients are detected during routine eye screening. These patients will initially experience a gradual loss of peripheral vision, and with time, it will progress into tunnel vision. They will also have fluctuating pain, headaches, blurring of vision, and halos around lights. The diagnosis of glaucoma can be done with a quick physical examination in the case of angle closure glaucoma. A history of peripheral loss of vision can also help us to come to a diagnosis. We can use tonometry to estimate the intraocular pressure, and a fundoscopy exam will demonstrate cupping of the optic nerve. Glaucoma can be managed with drugs such as prostaglandin analogues to increase the outflow of aqueous humor. Topical beta blockers like timolol and carbonic anhydrase inhibitors such as doselamide to reduce the production of aqueous humor. And intraocular pressure-reducing medications such as pilocarpine, glycerol, and mannitol. Pilocarpine is a muscarinic agonist that causes miosis or constriction of the pupil and ciliary muscles. This can open up the angle between the iris and the cornea to facilitate drainage of aqueous humor in the eye. When it comes to the management of acute angle closure glaucoma, it's important to remember that this is an ophthalmologic emergency that can lead to rapid irreversible vision loss. Therefore, immediately referring the patient to an ophthalmologist is important. You can ask the patient to lie on his or her back and give pilocarpine, acetazolamide, analgesia, and antiemetics while you wait for the ambulance. You can also treat open-angle glaucoma with surgical procedures like trabeculectomy, which creates a new pathway for the aqueous humor to drain from the eye by removing a part of the trabecular meshwork. Angle closure glaucoma can be treated with laser iridotomy by using a beam of laser to create a hole in the iris. This allows aqueous humor to easily flow from the posterior chamber to the anterior chamber of the eye and drain away. This brings us to the end of our video on glaucoma. Thank you for listening. Have a great day.